Hello, my name is Dr. Shiri Sada Sharvet, and I would like to share with you today the main findings of a paper we recently published in the journal Family Process, entitled Interventions to Empower Adults with Eating Disorders and Their Partners Around the Transition to Parenthood. My colleagues, Christine Ronfula, Cynthia Bulik, James Locke, and Madeline Sachs, and I summarized the available research on adults with eating disorders and their partners during the transition to parenthood. We also reviewed the number of interventions that were designed for this population. The transition to parenthood is a major milestone in an adult's life, but the joy and excitement could be accompanied with stress and worry. Experiences of incompetence, of not knowing what to do, and changes in the couple system are part of the normal reactions that every couple experiences. However, a context of a history of a mental disorder often complicates this natural transition. Mothers with symptoms of eating disorders report greater incidence of postpartum depression, decreased parental self-efficacy, and early onset feeding and eating problems in their children. Their partners often want to help, but they do not know how. Some partners become avoidant due to the fear of saying something counterproductive or doing something negative, whereas others feel such anxiety that pushes them to react in more critical or blaming way. These patterns can unintentionally reinforce or increase the eating disorder symptoms, as well as its shame, secrecy, and self-critical nature, creating a damaging interactional style. Given these data, we also reviewed several programs that were particularly designed for this population. Two programs were designed to support adults and their partners in addressing the symptoms of the eating disorder. They are called UCAN, Uniting Couples in the Treatment of Anorexia Nervosa, and Unite, Uniting Couples in the Treatment of Eating Disorders. These programs focus on improving couple communication around the eating disorder symptoms, building skills for better problem solving and emotion regulation. Another program is called Parent-Based Prevention. This is a focused intervention for parents and their partners, and it is designed to reduce the negative outcomes of their children and reduce any risks for problems in the feeding behaviors, eating behaviors, and parent-child relationship. In our paper, we also briefly mentioned a few other interventions that were not designed primarily for couples, but do include some couple sessions. And we review papers and studies that have shown empirical efficacy. One program is called Mantra, the Maudsley model of treatment for adults with anorexia nervosa. Mantra has a specific model that focuses on actively involving partners in the intervention. Finally, what could be some practical takeaways from this paper? We'd like mental health providers to be more cognizant of the impact that a parental eating disorder might have on the individual, on the couple, and on the family. And by knowing that, they can further support these parents, interview them, identify their difficulties, and provide interventions that are suitable for their condition. We also know that while couple-based and family-based and parent-based interventions for individuals with eating disorders become more prevalent, they are not universally available. Additional clinical efforts for educating and supporting parents and their providers are warranted and would reduce an important gap in care. Thank you for reviewing this video abstract. If you are interested in receiving more information about the paper, please go to Family Process webpage. Thank you.